Okay, so babies are more likely to live if they last in the womb for longer than 24 weeks. I have a couple pictures for you that I wanted to show you. First of all, this is kind of showing some growth of an actual human baby. So you can see from at the embryo at 8 weeks, okay, the embryo has a tail and it does not look very much like a baby. And then 12 all the way up to 40 weeks. By the way, when people say that pregnancy lasts 9 months, they do mean technically it's all through the entire 9 months. So an actual full-term baby is 40 weeks, and if you do the math, that is actually the beginning of 10 months. So that's what it means. So anything after 36 weeks is considered full term. But like I said, 24 weeks, a baby could still potentially survive. In here you can see that the big difference is that it's kind of growth of fatty tissue and length and weight, but it's also growing as the baby's also growing as far as lung development is concerned. I also have some personal pictures. So these were a couple pictures from when I was pregnant. This first picture was from my
Felicia Williams, please come to.
This first picture is of my middle child, my son. I did not have any pictures at the time when I was doing this of my daughter, who is my oldest child. But you can see that this is what ultrasound pictures really look like. And they look kind of funny. You're just like, what? This is when he was 4 months old in utero. So when I was pregnant 4 months along, you can kind of see that the bottom picture, you can see this line here. This is his spine. And then this is his face up here in the first picture. Okay, and you can see his eyes right there. All right, so that was his 4-month picture. That would have been the time where I could find out if he's a boy or a girl. My husband and I did not find out for any of our children if they were a boy or a girl. We like to be surprised, so we did not find out, but we were still able to get some ultrasound pictures. Now, with my last child, he actually was born in 2012, and these pictures, it was interesting because I had a different doctor when I was pregnant with my last child, and she had different requirements, and she actually did ultrasounds once a trimester, and so these are ultrasounds from 32 weeks, and when I was 32 weeks pregnant, so if you do the math, that's 8 months pregnant. And these are like 3D ultrasounds, so you can tell that these are much better, like picture-wise, than the ones up at the top. And you can see his face, and he's making a face there. He's got his lip kind of curled, and it looks like he's sleeping. He's kind of got his eyes closed. Okay, so huge differences in advancement of ultrasounds. So just the difference. I mean. The top one, my son is now 6 from the top one, and this bottom one here, my son is 2. So just the difference of 4 years and a different doctor. The difference is the capabilities of ultrasound. And then lastly, I wanted to talk about is newborns. So these are my 3 children when they were newborns, obviously different time periods. They're not triplets. So the first one was my daughter Olivia. She was born in 05, and she weighed 8 pounds 1 ounce. Then my son Gabriel, who was born in 08, and he was 8 pounds 6 ounces. And then my little guy, my last child, Aiden. Aiden was born in 2012, and he was 9 pounds 5 ounces. Yes, he was a hefty one. But I show you these pictures because newborns' capabilities, they actually are capable of things. You will notice in all 3 pictures that they're all kind of curled in. Their arms are curled in, their legs are curled in. That's still a result of being in utero. They're used to being in cramped spaces. But when they come out, they automatically have these reflexes. They know to cry to be able to get things. They don't learn that. That's an inborn thing. That's a reflex they have. They also have a reflex of looking and rooting for things. And if you touch the side of their cheek, okay, they will turn their head in search of a nipple. Okay? Then they will actually know how to suck. You don't have to teach them how to suck. Whether that you're feeding them and breastfeeding them or bottle feeding them, they know how to suck. Now, if a baby is premature enough, they won't know how to suck, and they don't have that reflex yet. And so they don't know how to basically eat and breathe at the same time. And that's a skill. It sounds really silly, but it is a skill that they need to be able to have. And so that's oftentimes, if they're preemies, why they, if they have everything else developed and that their lungs are developed and everything else, and their weight's good, they will sometimes have to stay in the hospital longer just because they don't know how to feed yet. And so the hospital is still feeding them intravenously through a tube because they don't have that sucking reflex developed yet. Whereas if you have a fully developed newborn who is past that 36-week mark, they generally know how to suck, they can go home, and they will thrive. So that's all I wanted to talk about with newborns. Next, we will talk about child development, and we will talk about how kids change in a lot of variety of areas. All right, talk to you later. And then the last stage is fetal, our fetal phase. And this is the rest of the pregnancy. Okay, so you'll notice that the first two phases were very, very short time-wise, but they were very extraordinarily important. Okay? But fetal phase, okay, the fetal phase lasts a lot longer. The fetal phase will last from 9 weeks until birth. Couple of things that's going on with the fetal phase. First of all, organs continue to grow. Overall growth of the baby. Anybody know at what point can you tell if the baby's a boy or a girl?
3 months.
A little longer than that. 4 months.
4, 5, 6.
You're just throwing out numbers, aren't you? Stop throwing a bunch of things at the wall and hoping one sticks. Okay, you can actually determine the sex of the baby by 4 months. By 4 months, they will ask if you would like to know the sex of the baby. You can have an ultrasound. They've actually gotten better ultrasounds. I'll show you, I actually have some pictures of my ultrasounds from my 3 kids. And what you will see is that my first, I did not dig out my daughter's ultrasound. That's my oldest. But my middle child, I have an ultrasound of him, and it's kind of grainy, and it's kind of like black and white, and it's hard to tell. You're like, okay, I think that's the head, and that's his back, and whatever. But when you try and go and actually determine the sex, the ultrasounds have gotten better, and they've actually gotten 3D, and I'll show you what I mean with my last child. We had a 3D ultrasound. But the other thing is that when determining the sex of the baby, if they see a penis, it's for sure a boy. However, if they don't see a penis, it's not necessarily a girl, because it may be a case the baby is not cooperating and it's just moving around a whole lot, and they're like, well, we think it might be a girl, but we don't really know, because it's moving around too much, we can't tell. And then all of a sudden, when they're born, it's like, surprise, boy! So, movement is felt between 5 and 7 months. Usually, if a woman has been pregnant before, they feel it a lot earlier, the second time or third time or whatever time around. If this is not their first go around, they feel movement a lot earlier. Movement initially it kind of feels like, when you have butterflies in your stomach and you're kind of a little queasy. And that's what it initially feels like, but as the baby grows, it really does feel like somebody's kicking you on the inside. So much to look forward to, right? I have literally had the experience, and I know many pregnant women have had the experience as the baby gets bigger and there's like no room to rove, where I've literally had a foot that, and I've had seen with pregnant women where you can literally tell, because by that time your clothes are so tight and you're so ready to be done being pregnant, where you can actually see on the side of the pregnant woman the foot, kind of like the shape of the foot on her skin. Okay? And so then you have this instance where you're trying to push, and you're pushing it around to try and get it a little more comfortable. for you. And yeah, they have been known to kick ribs, and depending upon the strength of the baby and the fragility of the woman, they have been known to break ribs.
Did they break a spine then too?
No,
But I mean, they get out of the rib, like.
no. Usually it's like a crack, you know. So, but you know, movement is important, obviously. Many babies are viable outside the womb around 24 weeks, but longer increases the chances of viability. Okay, 24 weeks is how many months? Do that. Quick, quick, quick.
9 months.
What? 6. 6 months.
4 weeks, 3 weeks. Did you
Okay, 6 months, guys. Around 6 months, so 24 weeks, a baby can be viable, not always, can be viable outside the womb. Now, the last few months of development are really crucial for lung development in particular. And so obviously if they are born that early, they will have to spend some time in the NICU. I have a friend that is a neonatal nurse, and she talks about how teeny tiny and small. I mean, if you have ever known anybody who had a premature baby, one of the common things to kind of judge on size, because when you're taking pictures of the baby, I mean, you're taking like close-ups, and so people don't get a perception of how small they are. Okay, the best example I always see is that men oftentimes take off their wedding rings, okay, and they can slip their wedding ring on the wrist like a bracelet on the baby. That's how small they are. Okay, think about the size of a ring. Now, men's fingers are bigger than mine, but I mean, that's the wrist. Yeah? Yeah. How early was he? Yeah. I think the smallest that I've heard of a baby that actually survived was 1 pound. And that was touch and go. And a lot of times they have developmental delays and things like that because of that. Doug?
If they can like come out of labor like 24 weeks, and you said the female phase like 9 weeks, that like only adds up to 19 weeks with the germinal and the embryonic phase.
If you're talking about, no, we're saying 24 weeks.